Hi, this is Dr. Naomi Simon at Mooresville Dermatology Center, and this afternoon we're demonstrating what is Botox and how is it used for facial wrinkles. Now, Botox is really a natural form of toxin molecule found in the environment, but don't let the word toxin scare you. The only thing that this molecule does when it's injected into the human face is temporarily stop the muscle movement that causes wrinkles. It's temporary, it only lasts for 2 or 3 months for most patients, and then you go back to making your full facial expressions again. So what many patients like to do is have the treatment done about 4 times a year to decrease the amount of muscle movement in their face that's causing the deep wrinkling, especially in the forehead, between the eyebrows, and around the crow's feet. And this is our patient, Paula. She's volunteered today to come in and have some Botox. Thank you, Paula.
Thank you.
Now, Paula's in her early 50s, and would like to reduce a little bit of the visible wrinkles, especially on the forehead here and the crow's feet area. And also just, what I recommend patients have it for is it makes you look more well-rested, a little bit less stressed out, and a lot of times, especially people who are serious, I do this a lot, we kind of make a mean face even when we don't mean to. And people might start asking you, what's wrong? Why are you mad? And you're really not. Your face is just wrinkling. So, and what I explain to people about how Botox is going to improve your skin is that, Paula, you have a few lines that you can see when you're not making a face, and those are called static rhytids or wrinkles. Now, go ahead and make a mean face for me and knit your brows together. Really mean. Okay. So these are called dynamic rhytids, and you can see, relax again, that these lines, especially right here, get a lot deeper when she's scowling. And so what Botox is going to do is it's going to prevent her from being able to make that mean face and deepen those lines. Also, make us a face like you're really surprised. Woo! Yeah, those forehead wrinkles really get deeper when she makes that face. Now rest. Good. So we're not going to completely eliminate all the wrinkles you see at rest, but what we're going to do is stop the muscles from moving and creating deeper furrows when she's raising her eyebrows. Now with my patients, and most patients who visit a dermatologist, they don't want to look completely frozen. They want to still look natural, look like themselves, be able to make a little bit of facial expression so people don't think, wow, she's had something done. And so I don't recommend that we overuse Botox. I recommend that we use just enough to decrease those deep lines, but not enough to make you look frozen, and so she'll still be able to raise her eyebrows a little bit. She'll still be able to knit her brows a little bit together, it just won't be these deep furrows. And then squint your eyes. Yeah, there you go. We'll put a little bit right here in the crow's feet area so that when she does smile or squint, these aren't quite as noticeable. Now, Paula, in particular, what is it that you would like to achieve with Botox?
I have that mean
look when you don't mean to?
Correct. So coworkers will say just exactly what you said. Why are you angry?
Right.
And I'm just not.
This could be good for your relationships at work.
That's right.
And they have done some studies showing that people who have Botox, they appear less stressed, they actually feel less stressed. Because it seems that there's a little bit of mind-body connection. When you're making those faces, you tend to feel more stressed. So this might make your whole work life transform.
Well, there you go. That's good.
Okay, so what I start off with doing is kind of explaining to the patient the muscles that we are going to treat here today. These are the frontalis muscles of the forehead. They're the ones that raise your eyebrows. And so we're going to put a little bit of Botox right along the top here, kind of the middle of the forehead, to make these move less.
Okay.
We don't go too close to the eyebrow. The reason is because if I put Botox right above your eyebrow all the way across, it would actually probably lower your brow, and you don't want that look. We do often sometimes put a little bit right at the tail of the brow, though, to make your tail of your brow lift a little bit. And especially for women, it gives you a little more open eye look.
Okay.
Now for the middle muscles, this is the procerus muscle, and these are the corrugator muscles. And we treat the procerus, the medial part, or the middle part of the corrugator, and the lateral part of the corrugator. If we only treat right here, sometimes people still move right there, and it looks a little funny. So we usually put 5 injections in. For the crow's feet, we treat the orbicularis muscle right here, and we just put a little bit superficially here so that when you smile, the wrinkles aren't quite as deep.
Great.
Okay? And you'll notice here that we're using real Botox cosmetic. I don't recommend that you have your Botox done at someone's home, a Botox party, a salon, or a non-medical spa. And really, most dermatologists recommend that you see a board-certified dermatologist or plastic surgeon for your cosmetic treatments to be the safest. Now, before we go forward with this, I'll just explain to Paula a few of the most common side effects. Some people do experience a little swelling right at the injection sites, sometimes a bruise if we nick a little vein and you have a little bruise there. Sometimes it's sore for a few hours, usually not, but sometimes. Sometimes people actually get a headache, but then after a few hours that usually goes away, and a lot of people use Botox for migraines, and Paula's actually done that in the past. She's had Botox for her migraines, which helps quite a bit. Very rarely there have been reports of ptosis of the eyelid, and what that means is that the Botox may move away from where we put it and make her eyelid droop. So close one of your eyes for me. If this happens to you after your Botox, call your dermatologist back right away. Extremely rare reports of Botox, not used by board-certified dermatologists for wrinkles, but used for other things, have caused problems like difficulty swallowing, breathing, or bladder dysfunction. There's not been a report of that with a dermatologist using Botox for wrinkles.
Okay.
So, and then also rarely people may have an allergy to it. There's a small percentage of patients who actually have antibodies to Botox and it just won't work very well for them. But that's pretty rare. I've never had a patient with that yet. So, okay. First thing I do is I have patients kind of do their maximum facial expression. And make some dots where I'm going to put the Botox, okay? So give me that mean stressed face again. Good. Strong muscle right there. Our 5 little injection sites. Okay, and relax. Good. Put the injection site right here at the tail of the brow. And then squint your eyes again for me. And usually we do three sites on the crow's feet here. Good, and then relax. And then raise your eyebrows. And again, we stay about 2 fingers above the eyebrow so that when we put it in here, it doesn't make her brow droop. Okay, we're ready to go.